My name is Dr. William Thompson, and I'm the Chief of Anesthesiology at Massachusetts General Hospital in Boston. I've been administering anesthesia for 28 years, putting patients into controlled unconsciousness for surgery, managing their pain, monitoring their vital signs, while they're in the deepest sleep modern medicine can create. I oversee 17 anesthesiologists, manage 200+ surgeries per month, and ensure that every patient who goes under general anesthesia does so safely, painlessly, and without awareness of their procedure. Anesthesia awareness. Patients waking during surgery, conscious but paralyzed, is every anesthesiologist's nightmare. It's rare, maybe 1 in 19,000 cases, but it happens. Patients trapped in their paralyzed bodies, feeling pain, unable to move or speak, experiencing the surgery while we think they're unconscious. On September 14th, 2023, I discovered something worse. My patients aren't experiencing awareness of their surgeries. They're experiencing awareness of me, my memories, my life, my thoughts. While they're under anesthesia, they temporarily become me. And some of them remember fragments when they wake. Massachusetts General Hospital is one of the most prestigious medical institutions in the world, the original and largest teaching hospital of Harvard Medical School. Our anesthesiology department is considered the best in the country. We handle the most complex cases, train the next generation of anesthesiologists, set standards for the field. I've been here my entire career. Residency at MGH, fellowship, attending position, then Chief of Anesthesiology for the past 11 years. I know this hospital better than I know my own home. I'm 54 years old, born and raised in rural Maine, small town called Millbridge. My father was a lobster fisherman, my mother a school teacher. I was the first person in my family to go to college, worked my way through Bowdoin, then Dartmouth Medical School, came to Boston for residency and never left. Being chief means I don't just administer anesthesia. I oversee protocols, manage staff, handle complications, teach residents. But I still take cases, still put patients under, still do the work I was trained for. I believe in staying connected to direct patient care. September 14th, 2023 was a Thursday. I had a full surgical schedule, 3 cases, routine orthopedic and general surgeries. The first patient was Richard Morrison, 62, scheduled for knee replacement. Standard procedure, general anesthesia, about 90 minutes. I met Richard in pre-op at 7:30 a.m., reviewed his medical history, explained the anesthesia process, answered his questions. He was nervous but calm, reasonable concerns about going under. Will I dream, he asked. Most patients don't remember anything, I said. The anesthesia creates a state that's deeper than sleep. You won't dream, won't experience time passing. You'll close your eyes here, and when you open them, the surgery will be done. At 8 a.m., we wheeled Richard into, or 3. I administered the induction agents through his 4. Propofol to induce unconsciousness, rocuronium to paralyze muscles for intubation, fentanyl for pain management. I intubated him, confirmed the tube placement, connected him to the ventilator. His vital signs were stable. Heart rate 68, blood pressure 118/72, oxygen saturation 99%. Perfect induction. I maintained his anesthesia throughout the surgery with sevoflurane gas, monitoring his depth of unconsciousness with BIS monitoring, a number between 0 and 100 showing brain activity. For general anesthesia, we aim for 40 to 60. Richard's BIS hovered around 45. Deep, appropriate unconsciousness. The surgery went smoothly. At 9:32 a.m., I began emergence, reducing the anesthetic gases, allowing Richard to wake. At 9:41 a.m., he opened his eyes. I extubated him once he was breathing adequately on his own. Standard recovery. He was transported to PACU at 9:47 a.m., groggy but stable. I checked on him in recovery at 10:15 a.m. How are you feeling, Mr. Morrison? Tired, thirsty. Knee hurts, but it's manageable. That's normal. The anesthesia will wear off over the next few hours. Any nausea? No, I feel okay. But can I ask you something weird? Of course. While I was under, did you say anything about Maine? About a red barn by a lake? I froze. No, I didn't say anything during your surgery. Why? I don't know. I have this image in my head. A red barn, weathered wood, sitting next to a lake, trees around it. Very specific, very clear. Like a memory, but it's not mine. The red barn by the lake. My grandfather's property in Millbridge, Maine. The barn where I spent summers as a kid, fishing with my grandfather, learning to fix lobster traps. A place Richard Morrison had never been, never seen. couldn't possibly know about. Anesthesia can cause strange dreams, I said carefully. False memories, confabulations. It's normal. Yeah, probably. Just felt so real. I left his room unsettled. The red barn was specific, too specific. And I hadn't thought about that barn in years, hadn't mentioned it to anyone at the hospital. My second case that day was Lindichin, 47, laparoscopic gallbladder removal. I induced anesthesia at 11:15 a.m., maintained it for 45 minutes, brought her out of anesthesia smoothly at 12:07 p.m. In recovery, I checked on her at 12:45 p.m. Mrs. Chin, how are you feeling? Good, considering. A little sore, but the pain is controlled. Excellent. Any issues I should know about? Just, okay, this is strange, but did you lose someone named Emily? My heart stopped. What? I don't know why I'm asking, but I kept thinking about someone named Emily during surgery. Or maybe right after, like a sad feeling like loss. And the name Emily, does that mean anything to you? Emily, my daughter, who died of a heroin overdose 6 years ago at age 24. A name I never spoke at work, a grief I kept private, a loss that still defined my life. Anesthesia can affect memory and emotion, I said, my voice tight. Sometimes patients experience confabulations, false emotional states. Yeah, probably. Sorry, that was weird to bring up. I walked away from her room shaking. 2 patients. 2 impossible details from my personal life. The red barn. Emily's name. My third case was postponed due to, or scheduling, giving me time to think. I went to my office, closed the door, tried to rationalize what I'd heard. Coincidence. Richard Morrison could have seen a red barn in a magazine. His unconscious mind created a false memory. Lindichin could have heard someone mention Emily, a common name, and associated it with sadness. But I didn't believe it. The specificity was too precise. The emotional accuracy too exact. Over the next week, I paid closer attention to my patients in recovery. Asked open-ended questions. Listened for anything unusual. September 18th, patient mentioned a girl with blonde hair who played piano. My sister Catherine, who I hadn't seen in 15 years since a family falling out. Blonde classical pianist. September 21st, patient said he dreamed about being in a boat, pulling up traps, cold water, early morning. My childhood mornings with my grandfather, lobster fishing off Millbridge. September 25th, patient described a feeling of standing in a hospital room, watching someone die, feeling helpless. My father's death in 2019 here at MGH, me standing at his bedside, unable to save him. September 28th, patient woke up crying, said she felt overwhelming guilt about something that happened years ago. My guilt about Emily's death. I'd been called to surgery when she'd asked to talk, told her we'd talk later, and she'd overdosed that night. They were experiencing my memories, my emotions, my life. While under anesthesia, they were temporarily inhabiting my consciousness. On October 3rd, I started documenting it systematically. Every patient I anesthetized, I interviewed in recovery with specific questions. Did you experience anything unusual while under anesthesia? Do you remember any images, feelings, or thoughts? Did anything feel particularly vivid or real? Out of the next 20 patients I personally anesthetized, 14 reported fragments that matched my personal memories. Details they couldn't possibly know. Emotions they had no reason to feel. Experiences from my childhood, my marriage, my daughter's death, my private life. The patients who'd been anesthetized by other anesthesiologists on my team reported nothing unusual. Standard post-anesthesia, amnesia. No memories of surgery, no strange images. Only my patients. Only when I was the one inducing and maintaining anesthesia. On October 12th, I had a patient named Sarah Martinez, 34, scheduled for ACL repair. I induced her at 2 p.m., maintained anesthesia for the 90-minute surgery, brought her out at 3:37 p.m. In recovery, she was more lucid than most patients, less groggy. I asked my standard questions. Did you experience anything during the anesthesia? Yeah, actually. It was weird. I felt like I was someone else, not me. Someone older, male, sad, really sad. And I was thinking about a daughter who died. Not my daughter. I don't have kids, but I felt the grief like it was mine. Can you describe the feeling? Guilt. Like I should have saved her. Like I'd been too busy with work and she needed me and I wasn't there. And then she was gone. It felt like a memory. But it wasn't my memory. It was my memory. My guilt about Emily. The night she died, I'd been in the OR for an emergency case. She called me at 7 p.m., asked if we could talk. I'd said I was in surgery. We'd talk when I got home. By the time I got home at midnight, she was dead in her apartment, heroin overdose alone. Sarah Martinez had experienced my worst memory, my deepest guilt, the thing I'd never told anyone at MGH. I'm sorry you experienced that, I said quietly. Anesthesia can create very realistic false memories. It didn't feel false. It felt real, like I'd lived it, because she had, while unconscious, she'd lived my memory of Emily's death. She'd felt my guilt, my grief, my failure as a father. I left her room and went to the chapel, a quiet space in the hospital I never usually visited. I sat there for an hour, trying to understand. Every patient I anesthetized was experiencing my consciousness, temporarily becoming me, living fragments of my memories, feeling my emotions, thinking my thoughts, then waking with no memory of the surgical procedure, but carrying traces of my life. Why was this happening? How was it possible for my consciousness to transfer to theirs during anesthesia? On October 18th, I consulted with Dr. Amanda Walsh, a neurologist who specialized in consciousness and anesthesia mechanisms. Amanda, hypothetically, could a patient under general anesthesia experience someone else's memories? Whose memories? The anesthesiologists. She looked at me skeptically. That's not how anesthesia works, Will. We suppress consciousness. We don't transfer it. Why are you asking? Just a theoretical question about consciousness and identity during unconscious states. Theoretically, we don't fully understand consciousness. We know anesthesia suppresses it, but we don't know where consciousness goes when someone is under. Some theories suggest it's not actually gone, just disconnected from sensory input and memory formation. But transfer between people? That's not supported by any neuroscience I know. What if patients are reporting memories they couldn't have? Details from the anesthesiologist's life. I'd say they're confabulating. The brain fills in gaps after anesthesia, creates false narratives. It's well documented. But what if the details are too specific, too accurate? Amanda studied me. Well, are your patients telling you things about your personal life? I couldn't answer. If I told her the truth, she'd think I was having a breakdown. If I didn't tell her, I couldn't get help understanding what was happening. Never mind, just theoretical curiosity. But it wasn't theoretical. It was happening. Every patient I anesthetized temporarily became me, and I didn't know how to stop it. On October 25th, I had a patient who changed everything. Michael Park, 19, emergency appendectomy. I induced him at 4:45 p.m., maintained anesthesia for the 40-minute procedure, brought him out at 5:32 p.m. In recovery, he was agitated, distressed in a way that wasn't typical post-anesthesia confusion. Dr. Thompson, I need to tell you something. What's wrong, Michael? Are you in pain? No, it's not that. Well, I was under. I experienced something. I was you. I went cold. What? I know how that sounds, but I wasn't me during the surgery. I was you. I had your memories, your thoughts, your life. I was 54 years old. I was the chief of anesthesiology. I had a daughter who died. I felt your grief. I knew things about you that I shouldn't know. Michael, that's a common side effect of anesthesia. I know about the Red Barn in Maine. I know about your grandfather teaching you to set lobster traps. I know about your sister Catherine, who you haven't spoken to in 15 years. I know about Emily, your daughter, who died 6 years ago from an overdose. I know you were in surgery when she called, and you never got to say goodbye. I know you blame yourself. Every detail correct. Every memory mine. He'd experienced my entire consciousness while under anesthesia. How is this possible? I whispered. I don't know, but it happened. While you were putting me under, while you were managing my anesthesia, I was living your life. I was you, Dr. Thompson. And now I'm back to being me, but I remember it. I remember being you. No one else remembers this clearly. Maybe I'm different. Maybe the anesthesia affected me differently. But I'm telling you this is real. Whatever you're doing when you anesthetize patients, you're not just suppressing their consciousness. You're replacing it with yours. I sat down heavily. This has been happening for 6 weeks. Dozens of patients. Most only get fragments, confusing images, emotional echoes. But they're all experiencing pieces of me. You need to figure out why. And you need to stop. Because it's not right. My consciousness, my identity, myself, it was gone during that surgery. I was you. Instead, that's violating something fundamental. He was right. I was inadvertently taking away my patient's consciousness and replacing it with mine. For the duration of their anesthesia, they ceased to exist as themselves and became me. On October 30th, I made a decision. I requested a meeting with Dr. Patricia Hall, the Chief of Staff at MGH. Patricia, I need to report something unusual. My patients are experiencing awareness during anesthesia. Traditional awareness? Conscious during surgery? No, they're experiencing my awareness. My memories, my thoughts, my consciousness. While they're under general anesthesia, they temporarily become me. She stared at me. Well, that's not medically possible. I have documentation. 14 patients reporting specific details from my personal life. Things they couldn't know. Childhood memories, family information, private grief. They're experiencing my consciousness while I'm managing their anesthesia. Have you been under unusual stress? Personal problems affecting your work? This isn't psychological. It's happening. Every patient I anesthetize experiences fragments of my life. Well, I'm going to recommend you take medical leave. This kind of belief that you're transferring consciousness to patients is concerning. It suggests you might be experiencing a psychiatric episode. I'm not having an episode. I'm reporting a phenomenon I don't understand, but can document. If what you're saying is true, it would fundamentally violate everything we know about consciousness and anesthesia. The more likely explanation is that you're experiencing stress-related delusions and your patients are engaging in normal post-anesthesia confabulation. Michael Park described my daughter's death accurately. He knew her name, the circumstances, details I've never told anyone at this hospital. Coincidence? Lucky guess? Or you mentioned it at some point and don't remember. I didn't. And it's not just him. It's dozens of patients over 6 weeks. Then you need psychiatric evaluation. I'm placing you on administrative leave effective immediately. On November 1st, 2023, I was removed from clinical duties. 28 years as an anesthesiologist, 11 years as Chief of Anesthesiology, ended because I'd reported that my patients were experiencing my consciousness. I underwent psychiatric evaluation, 3 sessions with Dr. Robert Green, a hospital psychiatrist. Tell me about your daughter, Dr. Thompson. Emily died 6 years ago. Heroin overdose. She was 24. And you blame yourself? I was at work when she needed me. I chose surgery over talking to her. By the time I got home, she was dead. That's a heavy burden. Could these reports from patients about experiencing your grief, your memories, be a manifestation of your own guilt, a way of externalizing your pain? I'm not projecting. The patients are independently reporting details they couldn't know, or they're picking up on subtle cues from you. Your body language, tone of voice, things you say without realizing during pre-op or recovery. The human mind is remarkably good at reading others and constructing narratives. What about the Red Barn in Maine? My grandfather's property? How would patients pick that up from subtle cues? You might have a picture in your office, a detail on your keychain, something visual they noticed subconsciously. I didn't have any pictures, no visual cues. But Dr. Green had already decided I was experiencing grief-induced delusions. His final report: Dr. Thompson is experiencing stress-related psychological symptoms following unresolved grief about his daughter's death. Recommend extended leave, grief counseling, and medication for anxiety before return to clinical practice. On November 15th, 2023, I was officially terminated from my position as Chief of Anesthesiology. The hospital's decision was framed as voluntary retirement with full benefits, but the reality was clear. They believed I was mentally unstable. During my forced leave, I researched consciousness, anesthesia mechanisms, theories of identity, and self. I tried to find any scientific framework that would explain what was happening. I found nothing. No documented cases of consciousness transfer during anesthesia. No theories that would support patients experiencing an anesthesiologist's memories while unconscious. But I knew it was real. I documented it, interviewed patients, heard impossible details from my private life. In December, I received an email from Michael Park, the 19-year-old who'd experienced my entire consciousness. Dr. Thompson, I've been thinking about what happened during my surgery. I want you to know I believe you. What I experienced was real. I was you for 40 minutes. I had your memories, your grief, your life. And I think I understand why it's happening. You spend your career putting people to sleep, suppressing consciousness, managing the boundary between awareness and unconsciousness. Maybe you've done it so many times, managed so many consciousnesses, that something has blurred, like your consciousness has learned to spread, to occupy the space where your patient's consciousness used to be. I don't know if that's scientific, but it makes sense to me. You're so used to managing other people's awareness that your own awareness has learned to fill that void. I hope you find answers. And I hope you know that experiencing your life, your grief, your love for Emily, it was profound. You're a good person carrying heavy burdens. Thank you for taking care of me, even in ways you didn't intend. I read that email 5 times. Michael's theory made a kind of intuitive sense. For 28 years, I'd been suppressing consciousness in hundreds of patients per month. Thousands of times, I'd put people into unconscious states, managed the boundary between awareness and oblivion. Maybe my consciousness had learned to fill that empty space. Maybe every time I induced anesthesia, part of me was occupying the void where my patient's consciousness had been. In January 2024, I took a job at a small community hospital in New Hampshire. They needed an anesthesiologist that didn't dig too deep into why I'd left MGH, and I needed to work again. On my first day, January 8th, 2024, I had a patient scheduled for routine surgery. I induced anesthesia, maintained it, brought them out safely. In recovery, I asked, "Did you experience anything unusual during the anesthesia?" No, nothing. I just went to sleep and woke up. Why? It hadn't happened. The consciousness transfer, the memory sharing, it had stopped. I felt relief and loss simultaneously. Relief that I wasn't violating my patient's consciousness anymore. Loss because I'd never understand what had happened or why it stopped. Over the next month, I anesthetized 40 patients at the new hospital. None reported experiencing my memories. None mentioned to the Red Barn, Emily, my guilt, my life. Whatever had been happening at MGH had ended when I left. In February, I drove back to Boston. I needed closure, needed to understand. I went to MGH, asked to speak with some of my former patients who'd experienced my consciousness. Richard Morrison, the first one, agreed to meet me. We sat in a coffee shop near the hospital. Mr. Morrison, when you woke from surgery in September, you mentioned a red barn by a lake. Yeah, I remember. You said it was just anesthesia dreams. It wasn't a dream. It was my memory, my grandfather's barn in Maine. You experienced my childhood memory while you were unconscious. He studied me. You're serious. Completely. For 6 weeks last fall, every patient I anesthetized experienced fragments of my consciousness. My memories, my emotions, my life. You were the first one I noticed. I don't know what that is. Impossible? Terrifying? Both. I wanted to ask, do you still remember the barn? Vividly. More clearly than most of my own childhood memories. I can see it perfectly. The weathered red paint, the lake behind it, the pine trees, morning light. It's like I was there. You were, in my memory, while I was managing your anesthesia. You temporarily became me. Why did it happen? I don't know. And it stopped now. New hospital, new patients, no consciousness transfer. Whatever was causing it was specific to MGH, to those 6 weeks, to some state I was in. Richard was quiet for a moment. Can I tell you something? That memory of the red barns, it's beautiful, peaceful. I think about it when I'm stressed. It calms me down. Whatever happened, you gave me something good. A memory of peace I didn't have before. I hadn't thought of it that way. I'd been focused on the violation, the impossibility, the horror of inadvertently replacing my patient's consciousness with mine. But maybe some of them had received something valuable. Memories of love, beauty, peace for my life mixed in with the grief and guilt. I'm 54 years old. I'm an anesthesiologist at a small hospital in New Hampshire, far from the prestige of MGH, working quietly without the consciousness transfer that defined my last months in Boston. I don't know why it happened. I don't know why it stopped. I don't know if it was real in any objective sense or if it was some kind of shared psychosis between me and my patients. What I know is that for 6 weeks, every patient I anesthetized temporarily became me. They experienced my memories, felt my emotions, lived fragments of my life. And some of them remember it still. I carry that weight, the knowledge that dozens of people out there have pieces of my consciousness in their minds. Memories of a red barn, a lost daughter, grief and guilt and love that weren't originally theirs. I violated something fundamental about identity and self. But I also inadvertently shared my humanity with people in their most vulnerable moments. I still think about Emily every day. I still carry guilt about her death. But now I know that others have felt that grief too, temporarily, while under my care. My patients experienced my worst memory and woke up alive, recovered, moving forward with their lives. Maybe that's what anesthesia has always been, managing consciousness, occupying the space between awareness and oblivion, carrying the burden of other people's vulnerability while they're unable to carry it themselves. For 6 weeks, I did it more literally than any anesthesiologist ever has. And I'm still learning what that means.